The state's Department of Health and Human Services gets an average 4 or 5 inquiries a year about possible cancer clusters. All are investigated, but rarely do they rise to the CDC's definition.
It involves identifying a very specific type of cancer in a specific population over a specific geography and in a specific time frame.
The cancer cluster identified on the seacoast began here in Rye in 2014. The study resulting in the first actual cancer cluster in New Hampshire since 2008. The one prior to that was decades earlier. The investigation underway now, creating a roadmap for how to proceed in the future. Seacoast residents listened in March as DHHS explained their study into 2 forms of childhood cancer, rhabdomyosarcoma, or RMS, and pleuropulmonary blastoma, or PPB. Using the state's cancer registry, they looked at 5 Seacoast towns going back 10 years, finding a small number of cases, but higher than statistically expected. 2 of Susan Kinstedt's 3 children now living with PPB diagnosed in 2014. Though it has a genetic component, she's among the many mobilized in the community pushing for further investigation.
Only 15 to 20 kids annually in the United States are diagnosed with PPB. So given the cluster of a similar cancer in this area, I am concerned.
Lydia Valdez was 9 when she passed away from RMS in 2013. Her mom pushing for research into treatment and a cure.
If the gene is dormant for so many years and then suddenly a tumor forms, was there an environmental trigger?
The study didn't find one. Dr. Chan says that's usually the case, but DHHS has broadened its investigation.
We're not only investigating that further, we're also trying to address the additional concerns people may have about specific environmental exposures. The Coakley landfill is one of them. The Pease Trade Port is another. Both of those are EPA Superfund sites.
The Coakley landfill is in the midst of the 5 towns. The community insists it and area wells be tested for PFCs, a contaminant of emerging concern.
There is absolutely no evidence that makes that linkage, but that alone doesn't make me feel comfortable. I want to know exactly what my exposures are. I live here, my children live here, I've raised my children here.
State Rep Tom Sherman is a local dad and doctor, joining other local elected officials, affected parents, concerned community members, the EPA and DES in a DHHS team approach.
Part of that health assessment is in the children who have gotten sick, what has been their exposure, not just in the air, the water, the land, but also in the home.
Dr. Chan calling the investigation the most extensive in his tenure as state epidemiologist.
The concerns about cancer and concerns about environmental exposures are going to be increasingly common. And that's not something that we have a lot of experience with in the Department of Health, but we are looking at trying to increase our capacity to be able to respond to these types of situations in a much more rapid and uniform response.
The process and whatever information is gathered expected to benefit us all. On the Seacoast, Jennifer Crompton, WMUR News 9.